Hello everyone. I'm Dr. Amitha Indersen. I'm the head of the Department of Fetal Medicine in Apollo Cradle Hospitals. I'm available both in Apollo Cradle Kondapur as well as in Jubilee Hills. So we thought we'll discuss a few things about fetal medicine. Fetal medicine is a very new field. So far, traditionally in pregnancy, it is usually the mother who gets all the care. But now the fetus has become a person with an identity of its own. It has become a specialty where care of the baby in the womb has become important now. So, what is fetal medicine? Fetal medicine is a field where we look at the baby starting right from the beginning of conception. We look at the baby at each stage of development, making sure that the development of the baby is as per the period of pregnancy. But fetal medicine is not just about looking at the growth or looking at the parts of the baby. It also involves a lot of other things. For example, when we do the first trimester screening, we are screening for the possibility or the risks of chromosomal problems or genetic problems. We also are looking at the risks of the baby developing growth issues later in pregnancy. We are looking at the risks of the mother developing problems like hypertension in pregnancy. So it is more of a comprehensive assessment of risk for the mother and the entire pregnancy. This is your NT scan. If the mother has to have just one scan in pregnancy, the best one would be your TIFA scan, anomaly scan, which is done at the end of the 5th month of pregnancy. Now, this is because we look at the baby's growth, we look at each and every organ in detail, making sure that there is no structural abnormalities in the baby. This also gives us an indication whether there is any risk for problems later in pregnancy also. So we look if there is risk of preterm labor or mother developing preeclampsia, things like that. So there is a conception that, fetal medicine means getting scans in pregnancy. But fetal medicine is not just scans in pregnancy. It is a field which includes genetics. We also look at identifying or, detecting patients who are at risk for problems of genetic issues, patients who are at risk of inheriting problems from their family. And if there is such a risk, there is a possibility where we can do procedures like amniocentesis. We take out a sample of the fluid, do the genetic tests, and we can identify if the fetus is affected, whether the baby is going to have a problem or not. Now, amniocentesis is something that has now become day to day. People are aware of it. Similarly, there are a lot of other procedures. If there are abnormalities, earlier, the only option used to be termination of pregnancy, but it is not that way any longer. It depends on what the problem is. Now, there is a field called as fetal therapy. Now, therapy is something where we try to correct or to improve the outcomes of babies who have problems. For example, if we have a twin pregnancy where the babies are sharing a placenta, there is abnormalities in the growth, or if one baby is abnormal, the other baby is normal. Now, fetal therapy is an option where we can try to save both babies by doing a surgical procedure to the pregnancy. That is, we are trying to do a surgery inside the womb using methods like radiofrequency ablation or laser, or there are even options now where they are doing fetal surgery itself. So it is a very fast advancing field, and where the technology also has improved so much, which gives us a lot of options where we can try to improve the outcomes for the baby which is yet to be born. So fetal medicine is a new and upcoming field, and it is a field which offers a lot of hope. Now, we have all heard of pregnancies where they had a problem. We have all heard of abnormal babies. We have all heard of women who are worried about pregnancy. Fetal medicine is a field which can give you answers. For example, if the previous baby had an abnormality or a genetic problem, this is a field which can help to identify what went wrong. This is a field which can tell you how you can correct that or prevent that. So that is what we are looking at in fetal medicine. And of course, it is to make a healthier generation, to make happier mothers and happier citizens for our country. I'm talking so much about fetal medicine, and our mainstay are like how the doctor examines you with a stethoscope. My stethoscope is the ultrasound machine. Now, when you talk about a scan, the first thing that patients get worried about is whether there is going to be harm to the baby. When we are doing ultrasound, we are using only sound waves. This does not cause radiation exposure, so it is safe for the baby. Of course, if we are doing an invasive procedure, like for example, we are doing a surgical procedure on the womb, like we are doing a fetal therapy, or if we are doing a amniocentesis, there is a procedure related risk, but again, we will always weigh the benefit versus risk. For example, if there's a risk of miscarriage, and that will be informed and explained to the patient before the procedure, and it will be done only and only if there is a definite benefit by doing the procedure. Fetal medicine covers the entire period of pregnancy. Ideally, it actually starts from even before conception. For example, when a mother is planning a pregnancy, it is important that they have a pre-conceptional counseling from around 3 months before pregnancy, because we sometimes need to start medications to correct problems as early as 3 months, simply because once the mother realizes she's pregnant, by the time she reaches hospital, usually it is around 5 or 6 weeks of pregnancy. And by that time, the heart of the baby, the spine of the baby is already formed. So whatever medication or supplements are added after doesn't really change the outcomes. So it is important we start from very early. And as I said, it is important that we monitor the pregnancy at every stage of pregnancy. If there is an abnormality, there is a protocol which we follow, that yes, we do identify the abnormality, but also it is important when there is abnormality, we need to understand it in totality. We look at the baby as a whole, see if there is any other problem other than the structural. If we, for example, see that the leg is abnormal, we also make sure that there is no other abnormality in the baby. We make sure that there is no genetic cause for the abnormality, because if there is a genetic or chromosomal cause, even if we correct the abnormality, there might be other problems. So we make sure that there is no associated problems, or if there is associated problems, we see how that can be managed accordingly. After we understand the problem, the next stage is to see if it is going to progress. As the pregnancy continues, if the condition is going to worsen, will the baby improve? After that, we plan for any corrective procedures if possible. Lastly, we think about what is going to happen to the baby after delivery. It is not just giving a diagnosis, giving a report saying that there is such and such a problem. Fetal medicine also includes planning for delivery and planning for the care of the baby after delivery. For example, if the baby has a heart problem, within a few weeks after the diagnosis, say if the problem is identified by the 5th month, by the end of the 6th month, the parents already know if there is any other associated problem, is there a genetic cause, and they also know what is the outcome going to be. Will this baby survive? What kind of surgery will the baby have to undergo? What are the other specialties they need to go and meet? Also, how much is the cost factor and other complications that are possible in this pregnancy? So, fetal medicine is a multidisciplinary field where we include all other specialties, and the aim of fetal medicine is to provide a comprehensive care to the baby while it is in the womb, preparing and setting everything in place for a healthy delivery as well as a normal outcome for the child. So, fetal medicine is something we are talking about now. But in earlier days, there were pregnancies that were happening without fetal medicine. But again, at that time, we have all heard about babies who were being born with abnormalities which were not detected until delivery. The numbers of such deliveries has drastically reduced, mainly because of good fetal medicine care. And the thing is, once those babies were delivered, there was nothing much that we could do after that. Now, with fetal medicine, there are options where we can look at helping those babies even before they are born. So that makes a lot of difference. And it is important to understand that the mother and baby, they present together. So when we are looking at fetal medicine, we are also looking at the health of the mother also, because a healthy mother makes a healthy baby. So by fetal medicine, we are improving the health of the mother as well as the child, making sure that the pregnancy as a whole is healthy. In this center where I work, we have around in Kondapur Center, we do around 1,200 fetal medicine procedures every month. In my other center, which is like Kondapur, we have more than 500 procedures or like antenatal scans, fetal medicine consultations that are happening every month. So the numbers as well as the awareness about fetal medicine is increasing very rapidly. And in our city in Hyderabad, we have to acknowledge that it is much better than many other parts of our country, and the facilities available also are much better. For example, we in our center are offering options of fetal therapy, which is like correction of problems when the baby is in the womb, which is something that is not available in most parts of our country. So one of the common questions that patients ask are, when should we consult a fetal medicine specialist? Ideally, the fetal medicine specialist will be able to help you out for risk assessment for the pregnancy, which is, as I mentioned, at your 3rd month scan and your 5th month scan, which will give you a risk assessment for the entire pregnancy. This is generally for any pregnant woman. Doesn't have to be a high risk pregnancy, doesn't have to be somebody who has a problem. Even otherwise, the other problems that we encounter or the problems that we see in patients are if there is any history of a genetic problem. If the mother has any kind of a medical disorder, for example, most common in our country is diabetes. If the mother is a diabetic or hypertensive, then it becomes important that they meet a fetal medicine consultant. And if the previous scans done outside show any kind of abnormality, be it in the baby, be it in the growth, or if there is fluid problems, if there is problems in the growth of the baby, it is important that you meet a fetal medicine consultant and understand what is really going on and if that can be corrected. And of course, it goes without saying that if there is an abnormality, the patient has to be followed up in a fetal medicine unit, because this gives us awareness for this pregnancy, and it is important that the information gained at this time helps plan for the next pregnancy also. So fetal medicine is something that starts with the conception and continues all through pregnancy and extends into the period immediately after delivery also.